After being crafted in secret, the bill has finally been forced out into the open as Republicans try to pass it before they leave for recess at the end of this week. And every day the bill spends in the glare of public attention, the more criticism it attracts from just about every direction. Tonight, Democrats are planning to hold the Senate floor late into the night to protest the Republican bill, which is headed for a vote with 0 hearings and very little debate. But Senate Democrats are the least of the bill's problems. Within the last hour or so, Republican Senator Susan Collins said she would vote against the bill in a crucial test vote. And after the nonpartisan Congressional Budget Office released its highly anticipated analysis of the bill, which finds that if this bill passed, 22 million more people would be uninsured by 2026 compared to current law. That includes 15 million more people just next year, including 4 million with employment-sponsored insurance. By 2026, the bill would reduce the federal deficit by $321 billion, according to the CBO. Average premiums in the individual market would spike in the next couple of years. And while premiums are projected to decrease starting in 2020, the crucial detail is this: deductibles and other out-of-pocket expenses would rise. The CBO score isn't likely to comfort any of the Republican senators sitting on the fence, and the Senate bill's problems don't end there. The bill is meeting resistance at the state level, with the bipartisan National Governors Association calling on Senate Majority Leader Mitch McConnell to slow down what has been an astonishingly rushed process. The National Association of Medicaid Directors, a bipartisan organization of state Medicaid agencies, called the bill's changes to the program, quote, unworkable. Meanwhile, a number of major healthcare industry groups have come out against the bill, including the American Medical Association, which represents the nation's doctors. The AMA wrote in a letter to Senate leadership, medicine has long operated under the precept of first do no harm. The draft legislation violates that standard on many levels. The American Hospital Association announced its opposition to the bill. And according to the president of America's Essential Hospitals, a coalition of hospitals that treat low-income patients, quote, this bill will close hospitals. It will hammer rural hospitals. It will close nursing homes. It will lead to disabled children not getting services. People will die. But after writing the bill in secret, proponents in the Senate and the Trump administration now appear to be trying to bluff their way through this 1 week of public scrutiny without having a real discussion about what the bill would actually do. Instead of defending the legislation on the merits, they're attempting to mislead the public.
The system, the plan that we would put in place would not allow individuals to fall through the cracks, we would not pull the rug out from under anybody, we would not have individuals lose coverage that they want for themselves and for their family.
These are not cuts to Medicaid, George. We don't see them as cuts. It's slowing the rate of growth in the future and getting Medicaid back to where it was. Obamacare expanded the pool of Medicaid recipients beyond its original intentions.
I have to strongly disagree with the characterization that we're somehow ending the Medicaid expansion. In fact, quite the contrary. The Senate bill will codify and make permanent the Medicaid expansion.
I believe in the free market system, and that if we are able to isolate the extremely high risks off to the side, and that if we're able to offer tax credits that allow people that aren't on group plans to buy coverage in a competitive environment, that they're going to have terms and deductibles that are reasonable for them. That's what the free market should do.
Right. So the CBO says that the majority of folks will pay more out of pocket for health care if this bill is passed.
Yeah, but
that is not what the President of the United States promised people.
Yeah, but the CBO is nothing but a bunch of voodoo economics. I mean, look how wrong they were on the number of folks that were going to be covered under Obamacare. They missed it by 120%. They said we were going to be growing over 3% for the last 6 years, and we haven't even hardly beat 2.
I just want to be clear here, because it seems like there's a tension between the arguments made for this bill. So, first of all, Tom Price appointed the man who runs the CBO. I imagine you think he isn't a shill. You just think they're getting it wrong, right?
Well, no, what I've been led to understand, and the Wall Street Journal's written about this, is that Peter Orszag, when he was head of OMB, is the guy that devised the model. And the model is a status model that doesn't give credit for any modification of behavior for a free market system.
So here's my question, though, right? Because there's 2 ideas that seem to be in tension. One is, look, we believe in a free market system, and a free market system is going to have winners and losers like any market does, right? We all agree. Things are expensive. You could buy them. Things are not, you don't make enough money. You can't buy them. So there's that at one level, right? We believe in a free market system. And the other is this idea that everyone is going to be better off. That's the argument Tom Price has made. It's the argument the president has promised. Everyone will be better off. You would agree that that can't be possible, right? There's going to be losers here.
Well, I would agree that everyone's going to be better off that buys insurance that will be replacing the exchanges, because the exchanges are a dismal failure. As far as the Medicaid expansion, as it's rolled back, it's going to be up to the states to figure out how much Medicaid they want to pay for.
But I just want to be clear on this, so I want to make sure I understand where you're coming from. The CBO.
Sure.
The CBO says many people will pay much more money out of pocket for worse health insurance in the individual exchanges under this plan, and that is clear in the architecture of the bill. That's not like voodoo economics. The bill is clear about that.
Well, no, what they're not assuming is that the competitive market will work to drive down premiums and deductibles by bringing more insurers into these markets.
Congressman Francis Rooney, thanks for making some time tonight.
Thanks for having me on.
I mean, have you ever seen legislation of this magnitude on this subject area undertake this trajectory process-wise ever?
No, never. I mean, I've stood out a lot of closed meetings in the Capitol and in the office buildings, but I've never seen a bill that's been done this way, and I think that's primarily because I've never seen a bill that actually creates more losers than winners. Often you get bills that create winners and losers, but this really is a bill that helps far fewer people than it would hurt, and I think the Republicans know that that's what they're resulting in.
That is the fundamental issue here.